Superintendent for Public Health, and I have the distinct honor of welcoming you all here today to Talking Public Health and to also introduce our guest speaker and my colleague, Dr. Sarah Moreland-Russell. Dr. Sarah Moreland-Russell is an associate professor in the School of Public Health, and she develops policy curricula, teaches several policy-related courses. If you are a student in the room, you may want to look up what she teaches because I hear her courses are so fixed. And she maintains an active research portfolio in health policy analysis and evaluation. Specifically, she has studied tobacco control and obesity prevention, organizational and system science and evaluation, and dissemination and implementation and sustainability of public health policies. Dr. Moreland-Russell began her career within medicine, switched to public health, and worked as a public health practitioner at the Monterey, California Health Department. Then returned home to her home state of Missouri to earn her PhD in public policy at St. Louis University. She joined the public health program at WashU as a research assistant professor and later became the associate director at the Center for Public Health System Science, where she worked in a lot of tobacco control policy. And then she earned a sabbatical by completing a fellowship in Washington, D.C., working with U.S. Senator Kristen Gillibrand in New York. When she returned to WashU, Dr. Moreland-Russell took a faculty affiliate position with our Prevention Research Center and was appointed as an assistant professor of practice and began working on research aimed at training to increase the capacity for sustainability of different public health programs. She is now leading a new project to understand how schools respond to changes in policy, guiding school lunch and breakfast programs, and how those responses affect health. And she's here today to talk to us about the power and possibility of policy. And with that, I'm going to turn it over to Dr. Moreland-Russell.
Thanks, Angela. Thanks, everybody, for coming today. I see some familiar faces and even students in the audience. So thanks for coming, and I hope to see many more of the students in my future classes to learn more about policy. It was working. There we go. Oh, now. Oh, okay. Okay. Start again. So today I want to cover three main topics. First, I'm going to talk about policy, the policy process, and policy implementation research. Then I'm going to discuss sustainability and some of the research gaps related to policy sustainability research. And finally, I will suggest some opportunities to influence policy infuse policy into public health and implementation science. So each semester, I ask my students in my policy classes to tell me one word to describe policy. These are some of the words that they use this spring. It's interesting to see how the words used to describe policy are often based on the current sort of political cycle and whether or not there's an election going on. But regardless, while some students express policy as important, many find it frustrating. Regardless of how chaotic, scary, or frustrating policy is, it's extremely important in our everyday lives. Policy is the foundation that shapes the structure of our society, and it influences the distribution of wealth, power, prestige, and ultimately our health. As we have learned over time, if policy is developed and implemented in a way that does not consider the effect on some populations or does not work to create equity in the distribution of wealth, power, and prestige, it can create health disparities. We can see the power of policy and its effect on health played out in our own backyard. This graphic is from the For Sake of All project, and it shows major health differences among residents in one zip code compared to another. Life expectancy is almost 20 years different from Clayton to North St. Louis. Although this is a little bit out of date, I think this report was in 2015, and efforts are being made to change policy to help reverse some of these major inequities. The information is still relevant. We know that health and overall life expectancy is based on the zip code of your residence. This is directly related to policy that has been put into place, specifically the structures and how it's had an effect on the environment that have ultimately benefited some and vastly hurt others. This is why policy is particularly important to public health. Policy is the predominant evidence-based intervention for improving health because it can reach the greatest number of people and therefore have a much greater impact on health. Each of the 10 greatest public health achievements of the 20th century were influenced by policy change. This includes everything from seatbelt laws and helmet laws to vaccination policy. As public health scientists and practitioners, we have a special interest in making sure that policy is evidence-based, equitable, and implemented effectively and works to eliminate health disparities. So how do we get from an idea or a need from policy to actual implementation? So this is the policy process is defined by the stages heuristic, which was introduced in political science in the 1950s by Laswell. I add sustainability because it may not have been considered in 1950, but it is definitely an important component today. So as we look at this, nice and linear, easy, progress from stage to stage, no problem, right? In my experience, the policy process looks more like this, a bit of a mess. The policy process is complex and does not always progress in a linear fashion as outlined in the stages heuristic. What the stages heuristic does provide is the components of the policy process. Today, I'm going to focus on implementation and sustainment and provide examples from my work that relate to these stages. But I want you to remember that these two stages do not occur in isolation of the other parts of the policy process. It is important that we conduct research that acknowledges the complexity inherent to the policy process. Okay, so before I dive into policy implementation, I always bring up the story of King Canute. So King Canute, in order to show the limitations of his power, waded out into the ocean and told the waves to stop soaking his royal robes. I use this in explaining policy implementation because we cannot just declare for a policy to happen or be implemented and expect it to actually happen in the way that we have designed it. We have to understand the context in which policy is implemented, starting all the way back to how the problem was originally identified and the solution for the problem defined. We also have to consider the politics, the implementation environment, and the implementers and other actors, and the system in which the policy is operating. So let me describe how policy implementation occurs. Policy implementation essentially occurs when a policy proposal is put into effect and implemented by government agencies and other organizations. Policy implementation involves three main components: actors, resources, and institutions. Actors can be broadly defined as those who have a stake in the outcome, from government officials to advocate groups to those who are considered boots on the ground or the actual implementers, to finally those populations who are hopefully benefiting from the implementation of policy. Resources include, of course, time, money, and staff, and institutions can include anything from local schools or local organizations to state and federal agencies. It is important to understand that policy can be implemented at a variety of levels, from the organizational level to the national level. Also, as illustrated by the red arrow, policy can be implemented with a bottom-up or top-down approach. This means that policy can be developed at the national level and implemented at the local level, or developed as a grassroots policy or initiative and implemented all the way up to state and national levels. As an example, let's take smoke-free policy. It really started at the grassroots organizational level with the adoption of smoke-free policies in places like hospitals and different workplaces. The policy movement really progressed and got more and more people involved, and later diffused into communities and states. We also generally talk about two types of policy, little p policy and big P policy. Little p policies are implemented at the organizational level, perhaps within a department or agency, and address organizational practices, define agency priorities and procedures, and outline internal and external processes. Big P policies are adopted at the community, state, and national level. These policies are far-reaching and therefore have a greater effect on a greater number of people. So in addition to different levels, there are a number of stages that need to occur before the policy can be implemented. Those who are responsible for implementing policy are tasked with translating the original intention of the policy into action. They also have to set the goals and design the plan for implementation. Essentially, if the policy as it was written represents a skeleton, policy implementation is the muscle and bones that make the body work. As this graphic illustrates, each step faces challenges that can affect the overall success of implementation and lessen the potential for affecting positive change. Everything from not considering the context in which the policy will be implemented or the potential for unintended consequences to not having enough resources can all affect implementation. Even if the policy makes it across the finish line to implementation, if there is not enough organizational capacity or buy-in among the implementers, or if there's no quality evaluation planned for mid-course corrections, policy implementation could fail. I'm hoping that in describing the complexities inherent to the policy process and policy implementation, I have made the case for why we need policy implementation research. Policy implementation research seeks to understand how the process of policy implementation can be optimized to maximize health benefits. Although policy implementation research is a relatively new concept for implementation science, it has been around in political science since about 1970 with Presman and Wildowski's book, Implementation. While it plays a crucial role in understanding policy implementation research has been vastly underrepresented in D&I research. In a review completed on NIH-funded D&I research between 2007 and 2014, only 8% of studies focused on policy, and that was work done by our great Ross Bronson. In recent years, the number of studies in this area have increased. The continued growth of policy implementation research is important for several reasons. First, it can help bridge the gap between theory and practice. Policy implementation research can demystify the how policies work by moving beyond simply evaluating whether a policy exists or is adopted and investigate how policies are put into practice. It can also enhance our understanding of policy implementation processes by examining the steps involved in translating policy intentions into real-world actions. It can uncover gaps or discrepancies between policy goals and actual implementation, allowing for adjustments and improvements to ensure policies achieve their intended outcomes. Finally, results from policy implementation research can also enhance policy efficiency and effectiveness by informing improved policy design, defining the most efficient and effective ways to allocate resources for policy implementation, and providing insights into how policies can be adapted to local context. Providing evidence-based insights through policy implementation research can inform policy decisions, ensuring that policies are developed more equitably and effectively. So now I want to provide an example of how we've used policy implementation research to examine the implementation of flexibilities to the National School Lunch and Breakfast programs. So essentially, anyone in this room who grew up in America has likely been a recipient of the services provided through the National School Lunch and Breakfast programs. The National School Lunch and Breakfast program was established under the Richard B. Russell National School Lunch Act and signed into law under President Truman in 1946. So it's been around for a really long time. The National Breakfast Program followed 20 years later. These programs are not on a reauthorization schedule. Rather, they are brought up for reauthorization only when major overhauls of the laws are needed. This can only be done by Congress through child nutrition reauthorization. I know it's a little bit complicated, but that's how it happens. Many child nutrition programs, including the National School Lunch and Breakfast programs, have permanent authorizations of appropriation. So that means essentially that Congress has to put money into these programs every single year. This is not discretionary funding, but mandatory funding. This is important because they're much less likely to sort of be threatened by the whims of politics. These programs are important in providing nutritionally balanced, low-cost, or free lunches to around 30 million children each school day. That is over half of all of the children in America aged 5 to 18. The program has consistently provided over 4 billion lunches each year for the past 54 years, with increased service to low-income children year after year. In fact, today, 88% of meals are provided on an average school day are provided to students at or below the 130th percentile of the federal policy or federal poverty level. This program is also incredibly important in reducing food insecurity and poor health among millions of children nationwide, as many of these children rely on the National School Lunch and Breakfast programs as their only source of food each day. In 2010, reform to the National School Lunch Program was being considered because obesity was an epidemic among children. In fact, obesity had increased more than threefold from about 5% in 1970 to around 18% in 2010 for all ages. School meals became a target for reform since a significant number of children, especially those who are suffering from poverty, were being fed by the school meal programs. Also, the school meal program standards had not been updated in over 30 years and were not up to date with current evidence-based dietary guidelines. So in 2010, the Healthy Hunger-Free Kids Act was signed into law by Barack Obama in an effort to combat the childhood obesity epidemic. Specifically, the act strengthened nutrition standards by mandating the Department of Agriculture to update school meals to align with the dietary guidelines for Americans. It also increased access to healthy foods by ensuring all children, and particularly low-income children, would have access to the nutrition they need. Finally, it improved the quality of meals by requiring schools to serve more fruits and vegetables and whole grains, provide meals with a minimum and maximum calorie range, reduce saturated fat, sodium, and trans fat, and provide only low-fat and non-fat milk. So this was a major policy, and it was planned to be implemented over 10 years. This often happens with national, large, broad-scale policies that are implemented at that are designed at the national level and implemented at the local level. At the time that the law passed, many schools did not even have kitchens, and most did not have a nutritionist on staff, so there were a number of implementation hurdles to overcome. However, in the past 10 years since implementation, research has established the effectiveness of this large-scale policy and has documented that schools have implemented the new nutrition standards and are offering healthier meals, and most importantly, that the kids like them and that they're eating them. The law also has had an effect on child and youth obesity risk. A recent study found that the law reduced risk of obesity over time, especially for those living in poverty. This study also projected that the obesity prevalence would have been 47% higher in 2018 if the Healthy Hunger-Free Kids Act would not have been implemented. So since its inception, there have been a number of proposed changes to the original act. One of the biggest changes happened in 2017 when President Trump, during his first administration, issued an executive order that allowed flexibilities to the school nutrition standards for milk, wheat, and sodium. President Trump at the time cited low participation in the school program, the National School Lunch Program, and low availability of some of the foods as the reason for the executive order. The flexibilities were challenged in the flexibilities that were implemented as part of the executive order were challenged in the federal court and overturned in the summer of 2020. However, because of the pandemic, schools were allowed to continue to implement these flexibilities along with others that allowed for flexibilities in how and when meals were served. The standards were reevaluated in 2022, and final standards were adopted in 2024, considering the previous flexibilities, newly released dietary guidelines, and stakeholder input. So what has changed in the past 6 years? Under the executive order and new policy regulations, schools could decide to implement several flexibilities. Specifically, schools were allowed to serve wheat products that contained only 50% rather than 100% whole grain. They were allowed to retain target 1 limits on the amount of sodium served in food over the school week, and offer flavored, fat-free, and low-fat milk. As part of the recent standards, the flexibilities have remained somewhat in place, but are moving closer to the original intent of the Healthy Hunger Free Kids Act. So now I want to show you the National School Luncheon Program system, or at least the system in which it operates. This complex system involves multiple levels from federal policy to the individual child. There are also several actors interacting across this system, including food suppliers, school food service directors, and ultimately student consumers. As highlighted on the left and right-hand sides of this slide, there are many factors that can affect the many levels of this system. You might imagine the effect that even a small change to policy might have on the system. Federal policy changes in the form of new laws like flexibilities can result in disruptions, inefficient implementation, and ultimately patterns of youth food consumption that diverge from the intended goals of the original policy. So to understand the effect of this federal policy change on the school meal system, we conducted a pilot study with 2 main aims. First, we wanted to determine how external and internal agents made decisions that affected the implementation of flexibilities. The external agents were representatives of the food industry, USDA, and local food suppliers. The internal agents were school food directors. Specifically, we wanted to assess whether they had implemented the flexibilities and why they had decided to do so if they did. Second, we assessed how the implementation of flexibilities affected student participation and milk consumption. So we used the components of the Consolidated Framework of Implementation Research to guide our design. Specifically, we used 4 domains from this framework useful in assessing policy implementation. These included intervention characteristics, or the evidence, strength, and quality, complexity, and cost of the intervention. Characteristics of the individuals, or the knowledge, beliefs, and self-efficacy of the implementers. The implementation process, which included planning, evaluating, executing, and reflecting or evaluating the implementation of the intervention. And the outer setting, which encompasses the economic, social, and political context in which the implementation is implemented. This was our conceptual model, which outlines the integration of the Consolidated Framework of Implementation Research with our overall aims. It also highlights some of the specific metrics within each of the Consolidated Framework domains as it aligns with our aims. Since this was a pilot, we focused our study on the implementation of flexibilities within schools in Missouri. We employed a mixed method approach to understand how recent policy impacted the school food system. We also conducted interviews with key representatives, including manufacturers, school food administrators, and USDA staff. We surveyed a sample of Missouri school districts to determine whether or not the implementation of flexibilities had occurred in the school. We then merged survey data with school level meal count data from the Missouri Department of Education, Elementary and Secondary Education, and used regression to examine how flexibility adoption related to the number of meals served. Finally, we reviewed comments submitted to the Federal Register regarding the initial proposed rule and comments for the revised rule to determine who supported the flexibilities and reasons for the support. So the Federal Register is something that exists at the national level, and anytime a rule is changed via executive order, they usually generate proposed rules. And at any given time, any person across America, whether you're a citizen, an advocacy group, some sort of stakeholder, a lobbyist, you can submit comments on the Federal Register about how you feel about the proposed rules. All of those comments have to be considered before a final rule can be adopted. So it's a really important part of the policy process that a lot of times, especially US citizens, have no idea it exists or how to access it, but it is important in designing final policy laws. So in our pilot study, we found that 82% of schools implemented at least one flexibility. This data was based on 146 responses from food administrators in Missouri school districts, representing about 528 schools. This represents about 26% of the schools in Missouri, so not a terrible response rate, but we could have done a little bit better. The most common flexibilities implemented were the wheat and milk flexibilities. The main reasons why school districts decided to implement one or more flexibilities were to improve participation rate and to respond to student preference. Other reasons cited were to increase menu variety, save money on products, and work through the logistics in food supply. So some of the schools couldn't access some of the products needed to comply with the original rules, and so they opted to implement the flexibilities. With the help of my colleagues, we looked at how the decision to adopt flexibilities related to the number of the meals served. Leveraging the time of policy adoption and controlling for changes in the school meal environment or enrollment across years, we found that the implementation of flexibilities was associated with roughly 326 more lunches and breakfasts being served per month. This increase was even more significant among free and reduced price meals. We also saw decreased participation of meals or of meals consumed or served for those who could pay for their own meals. So as the flexibilities were implemented, and potentially less quality meals were being served, those who could pay decided not to. We found this interesting in that the decision to implement could possibly result in the variations of food served to low-income children and further widen health disparities. In our interview with external stakeholders, the USDA found it difficult to change or focused on how difficult it was to change federal policy, even when using executive orders compared to legislative policy directives. They also highlighted the importance of stakeholders across the policy system and their perspectives of how things should be implemented or adapted. The food industry highlighted the need for time for product creation and formulation to meet new standards. They expressed that they were following the original Healthy, Hungry, Free Kids Act timeline because they felt they would have to meet standards at some point, and it was a waste of time or money to go back. So this pilot study provided some important initial insights into the policy system, guiding the National School Lunch and Breakfast programs, and also some important takeaways for policy implementation research. First, this study highlighted the need to include an equity lens in this work. It's important to identify which schools are implementing flexibilities to know if there's an inequity in meals served to specific populations. So you can imagine if some schools in rural populations versus urban populations decide to implement flexibilities versus those that don't, there may be an effect on the health of students. Second, this study really highlighted the need to focus at the level of the system, specifically when studying policy implementation of a complex system like the school food program. Third, we found the consolidated framework of implementation research was useful in examining several components of policy implementation, even though it was not originally designed for studying policy implementation. Finally, the COVID pandemic. So this pilot happened during the COVID pandemic, we really saw some changes happen, it allowed a number of flexibilities for schools to implement in order to still serve kids meals. So in addition to the flexibilities of the wheat, sodium, and milk, they were allowed to serve in different environments and allow sort of bagged lunches to go. Which is great, but again, it's another major change on a big system. And a lot of the schools couldn't access the products to create the grab and go meals. And so therein lies, some of the issues that may occur even when major events happen and can affect policy implementation. Okay, so this brings me to my next study. We actually just received a notice of award for this study at the beginning of February. So we were at the very beginning stages, but I wanted to share a bit about the design. So this project essentially mimics our previous study, but on a much larger scale and ties implementation to health outcomes specifically. So the purpose of this study is to describe the impact of flexibilities on the many levels involved in implementation to inform more equitable and efficient policy. First, we will assess current implementation practice and determinants of decision-making across a nationwide sample. This will give us a better idea of how many schools across the nation are actually implementing flexibilities. And we will use school level data to determine the effect of implementation of flexibilities on child health and education outcomes and identify relevant or related disparities. Second, we will interview representatives from the food industry and those who supply food to schools and determine how changes in policy result in decisions to change formulations and affect food supply. Third, we will develop an agent-based model. This is the most, I think, fun part, to demonstrate how flexibilities are likely to affect implementation of the National School Lunch and Breakfast Program and and ultimately result in inequitable food provision at the school district level. Our conceptual model still employs the consolidated framework of implementation, but it's gotten a bit more representative of the complexities of the meal system. We're still planning on examining the intervention characteristics, the inner and outer settings, the implementation process, and the characteristics of the individuals involved in implementation. We hope this project will have significant impact in informing the development and implementation of policy that affects school meals in the future. Specifically, we will document which schools have implemented flexibilities and what effect that has on child and youth health and education outcomes. We also hope to identify any inequities in the food served and the potential effect on health and education disparities. Finally, we hope to develop a dashboard as part of our agent-based model development as a tool to simulate changes and inform more equitable policy development. Okay, so now I'm going to switch gears a little bit and talk about sustainability and my new research project in this area. So we broadly define sustainability as the ability to maintain programming and its benefits over time. In order to increase the capacity for attaining sustainability, we believe But you must strengthen pre-existing structures so that the programs can weather changes in leadership, funding, and political climate. So for instance, if a tree in the ground is not stabilized by a strong root system, any strong windstorm could essentially knock it down. However, if a tree has deep and broad roots, it is more likely to weather the storm. Maybe not the storm on Friday, but most storms anyway. This is similar to how we understand sustainability. A program with strong infrastructure and capacity will more likely to be sustained if funding is cut all of a sudden. So why should we care about sustainability? First, implementation of newly funded programs does not guarantee that programs will last long term. Studies suggest that a significant portion of implemented programs, particularly public health and clinical programs, are not sustained long term, with only about 1/5 of them remaining active 2 years after implementation and even less after 4 years. Most importantly, we cannot realize the full benefits of our investment in public health research and programming over time if the programs are not sustained long term. Sustainability research has really developed over the past 10 years. We've made good progress in understanding the elements involved in clinical and programmatic sustainability, which are highlighted in these frameworks that I show here. We've also developed measurement tools to assess public health or clinical programs' capacity for sustainability. This is the program sustainability assessment tool, and there's also a clinical sustainability assessment tool. We have even developed evidence-based training for public health programs to increase their capacity for sustainability. As part of my last research project, the PACT study, we developed and tested the effectiveness of a novel action planning intervention, among state-level tobacco control programs, and our training was found to be effective in increasing the capacity for sustainability. So what is the gap in research? What we do not have is a framework to understand how to sustain public health policy long-term. This is important because many of the most important public health policies are challenged, changed, or eliminated, preventing the full potential for positive population-based impact. In the past couple of years alone, we've seen changes to policies that protect women's rights, policies that increase access to affordable care, and using my previous example, changes to nutrition policy guiding the National School Lunch Program. So we need to identify the key elements important to sustaining public health policy. To do this, Karen Joint Maddox and I have been awarded your next grant to hopefully fill this gap in sustainability research. The purpose of this project is to develop a conceptual framework for public health policy sustainability. Specifically, we plan to complete a comprehensive literature review to identify the components identified in literature relevant to policy sustainment. We will also survey policy experts representing policy practice, advocacy, and research, using concept mapping to determine what they believe are the most important elements to sustaining policy. Finally, we will bring together the results from AIM 1 and 2 to develop a conceptual framework on public health policy sustainability. So as part of this project, we hope to advance implementation science by developing a novel public health policy sustainability framework and provide a useful tool for practitioners when thinking about how to plan for policy sustainability. And we also hope to set the stage for future research to develop measurement tools to assess policy sustainability and build the capacity for policy sustainability. So I just want to end my talk with some of my ideas for opportunities to infuse policy into public health and implementation science. First, to infuse policy into implementation science, We need to increase interdisciplinary collaboration, specifically with political scientists, to ensure we consider the complexities of policy and of politics. We also need to engage other policy experts and practitioners on our study teams to consider real-world context, improve the overall design of our research, and hopefully enhance the translation and dissemination of our results to inform policy. At the beginning of this presentation, when I was discussing policy implementation research, I mentioned that it really has been around since 1970. That means we need to learn from the work that has already been done and use theories, models, and frameworks that borrow from political science, organizational management, and system science to ensure consideration of the complexities of the policy process when examining implementation. Second, I think there's an opportunity to infuse policy into public health by encouraging and supporting student and faculty training and engagement in the policy process. As many of you know, I served a year in the US Senate. There I learned the absolute need for public health practitioners and scientists to engage in the policy process. If we want to affect population-based health, we must learn how to engage in the policy process and understand that our work and science matter a lot to policy. We do not have to be amazing communicators or advocates, but we do have to understand the policy process and contribute toward the parts that need science to ensure that policy is implemented more effectively and equitably. One way to do this is to enhance our knowledge of the policy process and learn about and apply other theories from other disciplines. And I do this regularly in my health politics and policy class. So take that class and you can do that. Another way to actively engage in policy, of course, is to visit decision makers, especially if they're considering policy that relates to your work. We have often taken students to DC so that they could sort of be part of the policy process and educate policymakers on certain policies or science around certain policies in hopes to inform sort of the direction in which certain policies sort of are designed. Policymakers and decision makers really need data, and they often have no idea how to access it. So we need to be part of that process and lend our scientific expertise. And finally, on a more local level, I think we can be better at assessing what research is needed and design relevant policy research that helps local decision makers design more effective and equitable policy. So I want to say thank you to my research teams and thank you for being here today. And I'm happy to take any questions. You have a question?
Yeah, use the microphone so everyone on my computer. Thank you. Great presentation. I really enjoyed it. 2 questions and a comment, but I can come for the comment. I'll talk to you later about the comment.
Okay.
So the first question is, I'm not that familiar with US policies, state level, but I was wondering if you try to adjust for that in your pilot analysis on what type of policies do state provide for school breakfast compared to what they're getting from the federal government, and how does that shape the results of your analysis? And then the second question is, and I'm thinking about this a lot, and we actually put APMs because my comment, but how did you decide that lower paid lunch means for sure that there are inequities? Because we always think about inequities for one, we always have trade-offs. So maybe the benefits of just having more lunches just reduces the inequities altogether. So I was wondering, how did you get to say it was actually lower inequities?
So in relation to your first question, you've hit the nail on the head, right? So we want kids to eat lunch. And if they're eating more lunch, even with the adoption of flexibilities, That's really, really important, right? But it's also important that they eat more lunch that is also of nutritious quality. And so it's not necessarily that, you know, we tie the low income to sort of or define low income as being tied to the inequity. It's more in that students, not all students are receiving the same meals, right? And we want all students to receive the same meals. We may not find any inequities in health or education outcomes, and that's why it's really important, I think, for this new study that we're doing to sort of see that and tease that apart. In regard to your first question, so in the US, especially when policy is developed at the national level, it's usually developed very vaguely, and then it's implemented at the state level and then at the local level. So in the United States, because every state is different, how that federal policy is implemented at the state level and then to the local levels is different. So in Missouri, the federal policy, was essentially implemented. The state level decided to allow the schools to make the decision whether or not they wanted to implement. And so in other states, that may not be the case, like California. In other states, they may say, no, all schools are going to do this, and they just make that decision at that level. So we will have to account for that in the new study.
Great. This is really exciting. We have an APM US synthetic population in Python and C++. So if you want to see that for your analysis.
Yes, I'm sure Ross Hammond will definitely want that. Yeah, it's on.
Thank you so much, Sarah. That's so interesting. I wanted to ask about the research on the school lunches. If you've ever, or other people have asked the students who are receiving the lunch what their preferences are, and if they eat the lunches, or, not speaking from experience, but sometimes kids might eat the dessert and leave the rest of it if they don't, and whether they just have preferences before and after the implementation.
Yeah, so right after the Healthy Hunger Free Kids Act was implemented, there was quite a bit of uproar, and there were, waste studies done because they were saying, oh, the kids are not gonna ever eat this, they hate this food, it's going into the waste basket, right? So a lot of student preference, I think a lot of changes in formulation and products happened to sort of accommodate student taste. And student preference was really sort of evaluated and assessed during that time. Since then, since the adoption of flexibilities, we haven't really looked at student preference specifically. I think it's a good area. There really isn't any research on whether or not schools have adopted flexibilities. And so, of course, there's no research done on student preferences in schools that have implemented the flexibility. So I think that's a really interesting aspect and potentially something that we should add to the study.
Yeah, because I was thinking of the speaker last week that talked about when they changed the sodium in bread, and everybody thought people would have, protested, and then no one really even noticed the difference. It's possible you might see that, which would go against what people assume the students were thinking.
Yeah.
It's possible they do notice, and, they talk about carb with pizza day, and, that sort of thing. So it'd be interesting to look into that, but thank you.
Yeah, thanks, Mary. Great question.
Thanks, Sarah. That was terrific. Really clear and communicated well. My question is about food industry.
Okay. My question is about food industry too.
Knowing the power that it, imposes, and thinking about like your concentric circles where you have federal policy on the outside and food industry, but it's really kind of bi-directional in terms of the influence.
Yeah.
So how do you account for that in the way you're thinking and doing, asking these research questions?
Yeah, I mean, part of the reason that the milk flexibility happened is because of the milk lobby. I mean, we know in the dairy lobby, we know that. They were claiming that there was a decreased consumption in milk because, the low-fat version wasn't flavored, didn't have chocolate or strawberry, and so kids were not consuming as much milk. Of course, they have a bottom line, right? And of course, they're going to use their power to sort of affect how the policy is designed. Absolutely. in accounting for it, I mean, it definitely is part of the political context, and I think something that we should absolutely put in some research questions around. Just because right now, I think most of our research questions are around sort of what they've done to respond to changes rather than how they've informed changes. And so I think that's a really great sort of aspect to study in the future, especially since a lot of the research on the school and breakfast, national school lunch and breakfast programs do not even account for the food supply or the food industry. And so it's really important to sort of understand that not only as a context for formulation of food and food supply, but also as the politics sort of context too. So great question, great idea, Laura. Thank you. We'll add that. Jess is taking notes.
Well, great job, Sarah. Really interesting work, and thanks for putting it all together so well. So I wondered about in the third project, the policy framework project, the grant you have going now, if there might be an ability to tie that back to the National School Lunch Project, the R1, to say in later phases, begin to pilot test that tool, and maybe it would set up some other research around the sustainability of the whole school lunch program. And you could imagine, for example, that while states that are more flexible might have lower quality, but they might be more sustainable because they're responsive to more of the political climate than for others that maintain it no matter what the political needs in the state or local.
Right.
I guess a related question is, it seems like so much around schools is local. How much is the local almost like a confounder to the state level focus?
Yeah, I mean, and I think, you know, specifically in Missouri, it is very, very local. I don't know how much of a confounder it is because it's similar across the United States. You know, it may be that there's less of a political effect, at least a national level political effect seen at the local level, and maybe more of the local context is needed to be considered. And so, you know, in the design, I think it's important to probably understand the local context and maybe the politics around food and policy at the local context and how that might affect their adoption of flexibilities. You're absolutely right, I think, on the first point with the framework, sustainability framework. I think it absolutely could sort of serve as future research from the implementation study. And hopefully we can design, you know, more research, because it really is sort of an exact case of a policy not being sustained the way it was originally defined. And so, you know, how do we make sure that we plan for that in the future or design policy in a way that it can be sustained, or if it needs to be changed and then sustained over time. Did I answer your question, Ross? Okay.
Let the faculty do all the questions.
Yeah.
Not right.
Anybody back there, questions? Got one up here. Thanks so much, great talk. I was just curious, and I know you only had so much qualitative feedback from some of the actual food service directors, but also just surveying some of the school districts. Obviously, we know that Missouri is home to very urban areas and suburban and then very rural. And if you all took a look at how maybe some of that data was different based on where some of those school districts were located.
Yeah, that really came out in the qualitative interviews. And really in the rural areas, food supply is an issue. I mean, the urban areas, of course, there are major food suppliers that, you know, have contracts with multiple major school districts in St. Louis, Kansas City, Springfield. And so they're able to sort of use that for price competition, things like that. And in the rural areas, it's just not worth their time or money to go out in the middle of, you know, Missouri and serve and provide, you know, products. It's just less efficient and they don't make as much money. And so you see a lot of actually rural schools relying on sort of local suppliers in farms, and other, sort of more innovative, I think, supply, methods, but, there definitely is a difference, and there's a difference in how that might affect the decision to implement flexibilities or not, absolutely, yeah.
Yeah, I'm Shakir, one of the first years in the public health PhD programs. And I missed a little bit of your intro, but in the first project in your regression analysis, what were some of the variables that had the most effect on sort of why they were implementing?
That's a good question. The variables, I did not do the regression, analysis, my, biostatistician did, so I'm sorry, we can chat afterward and we'll, look through that, but, it ultimately, looking at. Well, I'll answer your question when we get done, how about that?
Hi, we have some Zoom questions.
Okay,
We touched on this a little bit earlier, I think, but someone asked, what specific equity-related metric will the study use to assess potential disparities and impact of the NSLP flexibilities?
yeah, so, what we're doing is, looking at child absence, as a proxy for health. And so, I mean, that's one of the main challenges, with, child health data, especially at the school level, is that we are not good in America at collecting it. I think New York State is the only state that collects, actual health data, on children in schools. So we use absence for that, and so child health, and education outcomes, will essentially be looked at for that.
Awesome. We have another question. Efficiency has been a really common term that has been thrown around lately in federal politics. In implementation science, do you think every program has to be efficient in all ways? Or do you think that some programs are made because there are no efficient way to address the problem? Your comment on food waste and public criticism of school lunch policy made me think of this.
Yeah, that's a great question. It's really tough to answer right now. So this is my own opinion, and what I saw even when I was in the Senate. No program is absolutely efficient, right? At some point, it operates in a way that it's trying to reach ultimate efficiency and have the greatest impact, but, you know, things can get in the way, local context, money, different policy changes, all sorts of things can sort of happen, to that program to make it less efficient. What's really important, I think, is to evaluate that program over time so that you have that data showing that ultimately a program is efficient because it is reaching its ultimate outcomes or goals. And if it's not, then be able to adapt it in a way that it does. Or if it's not, and it's no longer evidence-based, then we think about, you know, not continuing to implement that program and thinking about what might be more efficient and more effective in reaching program goals.
Okay, I think we are just right at time, so I want to thank everybody for being here, and thank you again, Dr. Moreland-Russell, for your fantastic talk.
I-
Yeah, that's so much.